Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm great. How are you?
I'm living it up. I hope you are too, and I hope all of the audience is. We're going to have a lot of fun and figure out how to heal your musculoskeletal pain today.
Yes, we are. And in case you don't know exactly what that means, we're basically talking about orthopedics, which is muscle pain, joint pain, tendon pain, ligament pain, back pain, neck pain, disc pain, knee, hip, or arthritis pain. And it could be stiff joints or dull aches that you have been experiencing for a long, long time. And if that's the case, you want to call the program here in the studio at 866-870-5752. That's 866-870-5752. When you phone the program today, you get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies, so if you're new and you've not heard of this kind of treatment before, you want to call us, tell Dr. Darrow about your pain, and you want that free book. The number again is 866-870-5752. And I want to remind you we're here Saturdays at 10 a.m., again at 1 p.m., and you can also go to Dr. Darrow's website, which is www.lastemcells.com. That's lastemcells.com. You can email him off of every page on the site and watch him performing the treatments on video. So then you get to see it, read about it, all that sensory data, and moves you into a new paradigm for musculoskeletal pain. Very exciting, Dr. Darrow.
I love it. I've been doing this work since 1998. And I always tell my patients, they go, "You work too hard." I go, "I don't like vacations. I like being here with you guys." And my wife says, "You need to take time off." I go, "This is time off." I don't know what else I'd do.
Well, if you do something and it doesn't feel like work, then it's kind of like being on a vacation every day, isn't it?
Yeah. You know, did you hear about the boss that called one of his employees into the office?
No. Do tell. Do tell.
Up.
I want to hear this.
He says, "Rob, you've been with the company for a year. You started off as an office clerk. 1 week later, you were promoted to a sales position, and 1 month after that, you were promoted to district manager of the sales department. Just 4 short months later, you were promoted to vice chairman. Now, it's time for me to retire, and I want you to take over the company. What do you say to that?" "Thanks," said the employee. "Thanks," the boss replied. "Is that all you can say?" "I suppose not," the employee said. "Thanks, Dad."
Oh, that's a good one. Our number here at the studio, I liked it, is 866-870-5752. Should we go talk to Jose in Moore Park?
Why not? Jose, Dr. Marc Darrow, how are you today? I understand your back is bothering you. Is that your low back you're talking about?
No, it's actually my mid-back.
Mid-back, okay.
I recently had an MRI done to figure out, because it's been bothering me for some time.
Sure.
It's a pain that comes from standing long periods of time or long walks, radiates out towards like right behind the shoulder blades.
Okay.
And it turns out that I do have I don't know exactly how you described it, but it's a bulging disc. It's a disc you can see it's perturbed on the MRI. It's out.
Okay.
It's one of the higher discs though, and that's what he suspects is ultimately, driving the pain that starts in my back, and it's a heat stinging pain that, ultimately, will get so bad that it causes me to sit down and get some relief.
How old are you, Jose?
57.
And what kind of work do you do?
A manager.
Okay. Do you do any lifting, bending, stooping, any sports like that that are repetitive? Golf, tennis, weightlifting?
I do some exercises on my own, stretching, but nothing, actually to try to alleviate the back pain. So, conscientious of what triggers the pain.
Sure. So, Jose, here's the deal. You're the guy that I talk about all the time. I need to touch your back, see where the pain is being generated from. It's very rare that there's pain from bulging discs, okay? As we get older, our discs bulge, I'm going to say naturally. I don't know if the word naturally is correct, but commonly. And that doesn't cause pain. But the areas you're talking about that are radiating out towards your shoulders might be from the connections of the muscle to the bone. That's called the enthesis. So you're the guy I would have to touch and see where the pain is coming from. Most likely we can use platelets and stem cells to heal up the areas that you're talking about. So the number to my office, if you want to call and get more information, get a pencil, is 800-300-9300. I'm going to repeat it for everybody else listening. It's 800-300-9300. So once again, I don't think this is pain from a bulging disc. And number two, these are things that generally are caused by where the muscles attach to different areas of the bone. It could be the rhomboid muscles attaching to the scapula. I'm not sure exactly where you're telling me. It could be the levator scapula muscle that attaches to the inner upper part of the scapula. It could be the supraspinatus that attaches to the top of the scapula. So I don't know, just listening to what you're saying, but it sounds like that's the issue. And if that is the issue, platelets and stem cells, or one or the other, can heal this usually really quickly. Okay, so there's good hope ahead for you. Any other part of your body bother you?
No, that's it. And, I've tried a few treatments. So it started about 3 years ago, and I've tried a few different things. And, as soon as I go on the long hikes or the long periods of standing, it comes back. So if I were to undergo the treatment you're describing, I would immediately, within months, I would know that I could stand long periods and not have that radiating pain come back?
Well, the first key is I've got to touch the area and see if I'm correct in what I'm telling you.
Okay.
If I think that I'm correct in what I'm telling you now, after I touch it, then usually something like that will take 1 or 2 treatments to heal up. And we generally treat, the day you walk in, we generally treat, if you want to. And then we wait a couple of weeks and then see how you're doing. And if you're not better, we'll treat it again. If you are better, you're done.
Would the MRIs be helpful in that assessment to you?
It's a yes and a no. It's helpful in that it rules out terrible things, but it's not helpful in finding the pain generator. And that's a great question. We talk about this every show, and I'm glad you brought it up. MRIs are great for showing what's going on inside the body. They're overly sensitive, and they show things that aren't really there, so we have to be careful. And then they show things like, let's say, bulging discs. But bulging discs don't generally cause pain. Now, traditional medicine thinks they do, and surgical medicine thinks they do, but the reality is they don't. So we have to be careful and use our hands. Did your doctor ever touch your body on the back where it hurts there?
Yes.
And what did he say when he touched it?
Yeah, he said, let's get the MRI and see what's going on.
Okay, so he didn't. Most doctors are they're not trained how to examine properly with their hands. Okay, so I'm not putting doctors down. I'm just saying what is. The way that guys like me are trained are with their hands. We've got to do an examination, find out where the pain is being generated from. So the MRI is what I call a red herring. It's like if you're looking at someone and you've got your hand up in the air saying, this is the problem, look at my hand, but your other hand is behind your back, and that's the real problem, and they don't show it to you, you got a problem. And that's what this is like. The MRIs are like a red herring. They show you things that aren't real. They're real in terms of structurally, but not real in terms of what is generating the pain. Does that make any sense or not really?
It does, and I'll give your office a call and see if you can figure it out, because I'm struggling with it.
Yeah, I mean, in 1 second I can touch it and let you know if I can help you. And again, the number to the office for everybody listening is 800-300-9300. And thanks so much for calling, Jose. And the number to the studio right now to talk to me, you can talk about yourself or your problems with friends that they have or family, anything that comes up in orthopedic medicine, your joints, your neck, your back, shoulders, elbows, wrists, fingers, arthritis, your hips, knees, ankles, toes, you name it. I inject all of those areas. I've been doing this since 1998. That's about 22 years or so ago, and I do it all day long. I've been told when I go to national meetings I do the most of anybody on the planet. I don't know if that's true or not, but I am a busy guy. I get about 60 to 80 new patients a month, and I am very busy. I love what I do, and I love the results that I get. If anybody wants to, they can go to yelp.com, YELP.com, and look at my reviews. There's a few nasty ones. Now, I can't make everybody love me, but most of them have very good results. I don't know. There's a lot of good sayings about, I forget what they are, about you can't please everybody. And this doesn't work. Right. Using regenerative medicine does not work on everybody for various reasons. The most common reason is people quit. They start it and they go, I did it once, it didn't work. And there are cases where it works with one treatment of PRP, using platelets from your blood or that mixed with stem cells. But most of the time it takes more than one treatment. And people ask all day long, how many treatments, Doc? I go, I don't know. I just don't know. I know when I've injured myself, I keep going. I've had some areas of my body, like my wrist, that was 50% better the next day, 24 hours later, and then I re-injected it myself a few times, and it's been completely healed for years and years, probably about 15 years since I've had any wrist pain. I was an avid golfer and tennis player, and I beat up my wrist pretty badly. And then my shoulder, I injured from weightlifting. I had a surgery that really failed and made my shoulder terrible. After the surgery, I woke up with it being very swollen like a balloon all the way down my arm. And it's a great story because it induced me to learn about regenerative medicine. And then I injected myself one time, laying in bed watching TV with my wife screaming at me, like, what the are you doing? And woke up the next morning completely full range of motion and pain-free. And then at that point, I was a complete believer in regenerative medicine. And I've done both my knees, I've done both my shoulders, both my elbows, my right wrist. I've done both my knees. Did I say that?
Yes.
Yes. So I'll say it again.
Say it again. It's important.
I've had great luck on my own body using regenerative medicine with platelets and stem cells, and I have great luck, if you want to call it luck, with most of my patients. And like I say, I'm not going to lie to you. It doesn't work on everybody, but the main reason is people quit. They go, I went to my orthopedic surgeon, he says it can't work, and so I stopped doing it. Well, you got to stick with the program if you want to, and if you don't want to, fine, go get a surgery. It's fine with me. I don't like the idea of it. I had one and it failed. And I get way too many patients who come in after failed surgeries, and then I have to patch them back up using regenerative medicine. So the good news is it still works after you have a failed surgery in many cases, but if you have something like a joint replacement, it's probably not going to work because what I do is biologic, meaning it's growing tissue. And I can't grow metal and plastic after you've had a joint replacement. And just about every day I get people who either come in or email me about their joint replacement, and I say, I'm sorry, not much I can do. You got to go back and talk to your surgeon and do what he wants to do with it. Also, I want to mention that you can email me, and I get emails all day, all night. I even get them while I'm sleeping from all over the world. And I answer all of them usually the same day. And you can do that through my website, which is amazing. It's got videos of me doing these procedures you can watch and see if it's something you think you might want to do. And the website is, get your pencil, write it down, www.lastemcells.com, www.lastemcells.com, and you can watch me doing these procedures. I've got all kinds of research on that. Just by you calling in right now, and I'm going to give you the phone number to the studio, you can talk to me right now. The phone number to the studio is 866-870-5752. I'll repeat it, 866-870-5752. If you call in, you get a free copy of my book, which is all about stem cell and platelet therapy. The subtitle is Regenerate, Don't Operate. And I know that we are in a culture of surgery and operating, and I love the surgeons, but I don't like all of the surgeries they do. There are studies in this book. There's, what is it, Nita, 264 studies or so.
Yes, exactly.
And there are studies that show that you can do a fake surgery and come out the same as if you had a real surgery. So why ever do a real surgery if a fake surgery would work, meaning don't do anything and it can work? We have people that call the radio every weekend who say, I was told I had to have a surgery and I didn't do it and I'm better anyway. So, the surgeries can have terrible side effects. I'm sorry. That's just the way it is. And my shoulder surgery was one of them. I had a terrible side effect. It made it much, much worse for a couple of years until I discovered regenerative medicine, injected my own shoulder, and healed it overnight. So I don't want you to think you're going to heal overnight. The average with musculoskeletal complaints is about 6 weeks to heal. I'm going to go to Jared. Thank you for calling, Jared. He's got shoulder pain. And Jared, you're in Bakersfield. Are you in Bakersfield right now?
I'm actually down here in L.A. area. I've got a business, so I'm picking up some inventory and then head back.
Okay.
But, yeah, I live in Bakersfield.
Okay. What kind of business do you have? What kind of work do you do?
I have a vending business, so service quite a few accounts, and I'm just picking up some inventory, yeah.
Okay. Do you do a lot of lifting with your shoulder, with your arm?
Yeah, I mean, it's not super heavy, but, I might lift 100 pounds or so, or, but during the day I might carry 30, 40 pounds, into 40, 50 different stops during the day.
Okay. So you're very active with your shoulder. And did you go to a doctor yet?
All I've gone to is I'm not sure what you call it. My wife has gone in to see this, she's a medical doctor, but she does adjustments to the joint.
Okay. Okay.
And
It might be a doctor of osteopathy. A doctor of osteopathy is called a DO, and they're trained very similar to a medical doctor. And if that's what it is, they're more interested in treating musculoskeletal things than typical medical doctors, and they use their hands very well. So that's a good doctor to be seeing. Have you seen that doctor already?
Yeah, I've seen her probably 6 to 8 times in the last 6 to 8 months. I can't.
Has that helped your shoulder at all? Did that help you?
It helped a little bit in that the only way to describe what I was having in my shoulder is it felt like all my muscles were a bunch of wires, and they were all tangled. They were all tangled when I straighten out the shoulder or do stuff, and now it feels like it's what I'm getting now is I'll get some pops in there now, but it feels like it has helped, but there's still something going on there. And it's my non-dominant shoulder, so it's my left shoulder. I'm right-handed. And
Yep.
she says she has people where they'll have something go wrong with their non-dominant shoulder, like a tennis player or stuff like that. And but I don't recall ever injuring my shoulder. But I'm 62 years old. I'm really active. I like to go hiking and backpacking, and I climb a lot of 14,000-foot peaks just to make sure I'm still fit. But the shoulder thing is so I've never had surgery or anything on any major part of my body. And
let me speak to you for a minute, Gerald, because I think I have the picture. First of all, there's the rotator cuff, which is 4 tendons that hold the shoulder into place in the glenoid, which is the joint, and also move it around. And those are the supraspinatus, the infraspinatus, the subscapularis, and the teres minor. You can look all those up if you like. They're what we call the sits muscles and tendons. And from all the wear and tear you've done, you said you didn't have a real injury, but that is an injury, lifting all of that stuff you do. It's little minor traumas all day long. You're very active. And probably one or more of those tendons has been worn down a little bit, or maybe torn. Doesn't really matter because we can heal it either way. And those are the things that I've had wrong with my shoulder and healed them up just by injecting myself with platelets and stem cells. And you may have a bursitis. There's a subdeltoid bursa that's underneath the acromion, which is the bone on top of the shoulder. So there's a lot of stuff going on there. I would need to touch the shoulder area and let you know where this pain is coming from, okay? It's great if you can get an MRI, but be careful not to get sucked into surgery because you have a tear or something like that. That's the problem with MRIs. When surgeons offer them, the goal